Hello, and welcome to the Nutrition and Life podcast. This is where we look at various nutrition and fitness-related topics through the lens of application. We want to give you practical takeaways so that you can create your healthiest, best self backed by knowledge. Now, on to the episode with your host, Coach Lisa.
Hello and welcome back to the Nutrition and Life podcast. My name is Lisa, I'm your host, and today I have the pleasure of speaking with chiropractic Dr. Michael Hartle, who is also a clinical nutritionist, a certified chiropractic sports physician, active release technique provider, and a certified strength and conditioning coach. Welcome to the show, Michael. I'm really excited to talk to you today.
Thank you. Appreciate the invitation.
I would like to give our listeners just a little bit of an introduction as to how you got into the field, what brought you to, of course, becoming a chiropractic physician, but also what got you into the strength and conditioning area. Mm-hmm. If you would like to give us a little bit of a background story, that would be amazing.
Well, when I was 15, my high school, they invited a bodybuilder powerlifter to come give a demonstration of some exercises at our weight room we had at the school. And I was just like, my eyes were just like wide open because I was just like, wow, this was amazing. So then I started going to a gym to start training. And then when I graduated from high school, I joined another gym where I started actually competing in powerlifting. And then I started getting involved in nutrition aspect because then a lot of the bodybuilders and powerlifters use nutrition and all that stuff to help enhance their gains and everything. So I started looking into that. When I was 18, I did hurt my back pretty bad. So I went to a chiropractic physician and he treated me, he fixed me. The year after I saw him, I competed in my first powerlifting competition. So that aspect there. So then when I went to school to become an engineer, I decided to switch gears and become a doctor. And I thought about either becoming a medical doctor or a chiropractic doctor. And then I decided to do the chiropractic thing in Minnesota. So I did that. And so when I graduated in 93, I was a chiropractic physician. And then I worked to get my diplomate in clinical nutrition because I use nutrition a lot with my patients to help not only enhance their ability to live life to the fullest, but also to help heal from their condition and everything.
Amazing. I love it. I mean, I obviously am fully in concordance when it comes to nutrition helping either cure injuries or prevent certain things, or simply helping anti-inflammation and aiding in performance. So what sort of clientele do you usually work with? Is it kind of general population? Do you have a lot of performance athletes as well, or just people who like to train a lot?
All the above. I have patients who are, I have one of my oldest patients, she's almost 96. Mm-hmm. She still drives to the clinic by herself and lives in her own place. I have kids who are young kids. I have one woman who brought her kid the other day in because she went and saw a medical doctor for ear infections and he wanted to put tubes in. She didn't want to do that. So she wanted to come see me for some more natural stuff. So we started adjusting him and started giving him some nutrition to help as far as enhance his ability to fight off the ear infections. So we have all different, and I also have a lot of performance athletes. We have a couple of colleges in town. Right now this is track season. So we see a lot of track athletes, softball, people like that. So again, we have kind of a smattering of everyone in the office.
Super cool. And if you don't mind, would you be able to just explain very briefly for someone who literally has no idea what the difference perhaps is between a chiropractic doctor, physiotherapist, or a sports surgeon, for example?
Well, and a surgeon, obviously, his main job or their main job is to actually do surgical aspect to repair. Let's say someone tears their Achilles tendon, to repair it. Okay. After that, the person can go see, say, a physical therapist to go through rehab to get their strength back up, or see possibly a chiropractic doctor to actually not only do the physical rehab, but then also to do the adjustment. Sometimes, obviously, once the healing happens in the ankle is going to be very stiff. The joints are not going to be moving right. You got 26 bones down there, so we need to get those moving. So again, you can see anyone there. Chiropractic doctor, one thing we are taught is to diagnose. I use x-rays quite a bit in my office, not necessarily with every patient, but most patients, to help see as far as what their bone structure is. Also, I do a physical and neurological exam on the patients to see what they're, compare right to left, front to back, and everything with that. So a lot of differences there. So a surgeon's job is to take care of the offending aspect.
Mm-hmm.
After that, I always tell patients it's their job then to get themselves better. And that means with seeing either a chiropractic doctor, a physical therapist, or we say physical therapist in the States. Outside the States, it's physiotherapists, like in Canada or Europe, that kind of stuff. But again, yeah, you need to do your due diligence to get better.
Awesome. I like that there's an onus on the patient, so to speak, or on the person themselves also. They can't just expect suddenly the physio to do a bit of passive mobility on them and suddenly everything is going to heal.
That's right.
So what are some of the most common injuries you tend to see, especially with people that are somewhat active? So to give you a background, most of our listeners, they strength train probably at least 2-3 times per week, have most likely been strength training for a few years, a good mixture between hypertrophy and strength emphasis. So yeah, what sort of injuries do you tend to see in that kind of clientele?
Well, I had a new kid the other day who's 18 years old, a track athlete at a local college. He actually has a right lower leg injury in the medial aspect of his lower leg there. And his tibialis posterior is definitely inflamed, but it's because his pelvis and lower back are definitely crooked. So when I took standing x-rays, his pelvis was dropped and rotated just standing still. So every time his foot hits the ground, different forces are going up left leg versus the right leg. So we need to equate that. Because I told him, I said, when you're running, your brain goes, right, left, but then it's going, this is different, this is different, this is different, this is different. And so even though his brain is moving him forward, his neurological system is kind of like running with the emergency brake on. And the emergency brake is designed to prevent your car, say, from rolling downhill or whatever else with your car. But again, it's not designed to drive with the emergency brake on. And so he's doing that. So he's building fitness on top of dysfunction, quoting Gray Cook, who's a famous physical therapist here in the States. We need to build fitness on top of function, get rid of that DYS and move it off to the side, because when you build fitness on top of function, you can build all the fitness you want. But if you build fitness on top of dysfunction, now you're going to have problems.
I like it. So would you say that lower back injuries are some of the most common things that you deal with?
Lower back, we deal with neck, we deal with very, very tight middle back areas, people who sit at computers for long periods of the day. We deal with shoulder issues, ankle. I got a couple of wrists in the office now that I'm dealing with wrist issues. So we got, I'd say probably low back and neck are probably the two most common. Neck, including like headaches and all that, pain going down their shoulders, down their arms and hands. But I would say I always tell people, you have 206 bones in the body. I can treat every bone.
That's awesome. Yes. Would you say that the neck injuries have increased in recent years with the use of social or phones, etc.?
Yes, there's kind of an unwritten syndrome called text syndrome, where people's necks are actually, when I take a standing x-ray from the side of their neck is going forward, neck's in front of their body instead of being on top of their body. And when you do that, a lot of times it has to do with, as far as, phones, iPads, computers, all this other stuff, things that are in front of us, our heads are always down looking at it. And you don't want to do that because it can actually start changing your physical structure. So when I take an x-ray of someone, they're just standing there, and that's what their neck looks like. And so I talked to them about, when you're using, yes, exactly, chicken necking, we like to call that. When I work for an organization called Strong First, we teach kettlebell, barbell, and bodyweight exercises. And so we call that chicken necking. But here's what's interesting. So I find, and there's really no research about this, but what I found, I've been doing this for 29 years, that when someone has an increased lumbar curve in their lower back, we call it hyperlordosis. Generally, you will also find a concomitant decrease in the curve or a reverse cervical curve in the neck with the head going forward.
Interesting.
So when I was in engineering, we had physics. So basically the human body has to have the gravity applied to it just as much as a chair, a car, throwing a baseball, all that stuff. So when you're doing that, so I told people that if you want me to fix your neck, I need to fix your lower back. You want me to fix your lower back, I need to fix your neck. And so we work on a whole body aspect with that.
I love that because truly, I mean, so many things are interconnected, and oftentimes we think, oh, my shoulder hurts, and you just think like, oh, just massage my shoulder, but in truth, it might be as much as your right ankle that's, I don't know, out of line because
Exactly.
of
Very much so.
is hurting. So I wonder if, especially for those particular areas, the neck and the lower back, if you have any favorite exercises or approaches in general to help combat that, because of course you can only tell people limit your social media time so much, or perhaps you might want to bring your laptop up higher so that you don't constantly look down. Yes, okay, they might listen to that, but nonetheless, over time they're probably still going to tilt their neck forward a little bit.
Right. There was a gentleman named Vladimir Janda, who is from the Czech Republic, and he actually created or put together something called the lower and upper cross syndromes.
Mm-hmm.
If you know what syndrome means, syndrome is a collection of symptoms put together. So it's not necessarily like diabetes is a specific disease, where syndrome means a collection of symptoms. So in his case, so he drew. So if you take someone, look at him from the side, and let's say you draw an X and you put the center of the X over the hip joint. You have a line going from the abs down to the glutes, and then you have a line going from the lower back down to the hip flexors. Generally, the line from the lower back to the hip flexors is we call the tight line, and the line from the abs to the glutes is the weak line. Mm-hmm. And so when you have the asymmetry between those two lines, you're going to have issues in your lower back. It's going to cause you to jam up the joints in your lower back. It's going to cause you to have weak abdominals, weak glutes, too tight hip flexors, too tight as far as lower back erectors. So basically the best exercise, not best, but one of the best exercises is a dead bug exercise. Oh, if you perform the dead bug exercise properly, you can actually see some changes in your lower back pain, because what it does is stimulates your abdominals, and it also helps stimulate as far as your core aspect there with that too. Second exercise would be doing like a floor bridge or a hip bridge, people call it. Unfortunately, most people do the hip bridge wrong. You need to, in my opinion, I've done this with many patients over the last 29 years, that you need to flatten your back, tighten your abs before you lift your hips up. Because when you flatten your back and tighten your abs, you take your lower back and you tell it to go take a nap. Get out of here. I don't need you right now. And you actually use your glutes. So you strengthen your glutes. So you got abs and glutes with that. Generally, most people will see some type of results with that.
That's a really good tip. I like that. I have heard from a few clients before, initially when they start off doing hip bridges or glute bridges, it only hurts my lower back more. And that would probably be particularly for that reason, that they're not doing what you just said.
Right. Well, one of the things we do I have my own physical therapy department in my clinic. When we do an assessment on every person that comes back there. And the assessment is designed to see where they're weak and where they're strong, and to give them the corrective exercises that they need for their bodies. And most people who have, like what you just said, where they do the hip bridge and they hurt their lower back, when they lay on their tummy, I have them do a prone hip extension. But I'm not just watching as far as from their heel to their buttock. I'm also watching from their buttock up to their head. And a lot of times people actually activate the lower back erectors much stronger than they do their glutes, and they activate the hamstrings. So glutes are kind of like in a distant, like third place, whereas you have your lower back and hamstrings working triple overtime. And so when they say they do hip bridge and their lower back hurts, I say, well, flatten your back, tighten your abs before you come off the ground, maintain it all the way up, squeeze the glutes at the top, and then bring it back down. And you need to do it in a slow fashion. Some people do it like 1 second. I tell people do a tempo like 5 seconds. So you do 2 seconds up, 1 second squeeze hard at the top, 2 seconds lower, and then you should not feel it in your lower back. If you feel it in your lower back, you need to reset, reflatten the back, tighten the abs, and then do it again.
Interesting. Would those also be the same kind of people that often complain of lower back pain from squatting heavy, perhaps, or something like that?
Perhaps, yeah. There's different reasons for that. So in our assessment, we actually kind of see the roots of the evil, so to speak, kind of with that. So again, you can even have right side stronger than left side, and that can also be causing some lower back pain when you're squatting. But maybe they have as far as good core strength and with that. So again, it could be different things with that. But yes, that could be one of the reasons.
Mm-hmm. And then do you have any exercises, particularly more for the upper back or the neck, I guess?
So Professor Yanda, he actually said the upper cross syndrome. So if you draw an X and you basically put it, let's say, at the bottom of your neck, the X, okay? The muscles in the front of the neck and the muscles between the shoulder blades are generally the weaker ones. The ones that are too tight are the erectors. And as far as you're pulling your head forward, your SCMs and things like that. So when you do that, you need to do two things. You need to obviously back to the lower cross syndrome. You need to do the stretching of the hip flexors and the lower back, in addition to the tightening of the abs and glutes, and the same thing in the neck. You need to work your deep cervical neck flexors, which you can do that by laying on the ground doing chin tucks. You can also, as far as working your upper back, get your rhomboids, get your serratus anterior, get the latissimus dorsi is also stronger too. Sometimes that can be too tight, but you got to do assessment to figure that out. And then also do your neck stretches. So you need to have a kind of a, I like to call it a yin yang, the Chinese yin yang thing, where you have an equal circle, but you have black and white. In this case, you need to do both your flexibility and mobility, and you also need to do your strengthening aspect as well.
That's such a good point. Yeah, most of the listeners here will probably usually default to wanting to lift too heavy and not wanting to bother with all these small little exercises that don't look quote unquote cool, like the neck tucks or whatever. But I think the great thing about those is that you can probably actually also do those just at the office, maybe 3 times a day for 5 or 10 minutes or whatever, doing a little bit of a neck tuck in the opposite direction, or even some exercises with bands I quite like sometimes for that reason, or something like face pulls. That's one of my favorites also. But yeah, particularly amongst strength athletes, what are the most common training injuries that you perhaps see there, either from overtraining or from lifting too heavy or anything like that?
Well, again, you alluded to lower back pain. I'd say low back pain is probably one of the most common ones. Most people get involved with strength training, and they already have some type of issue going on, but it may be what I like to use the term kind of sub-threshold. Like you have a certain threshold where pain's going to now be there. So they may be operating at sub-threshold level, and all of a sudden say do a heavier squat one day, and all of a sudden they have low back pain. Well, the squat must have caused my low back pain. Well, it was maybe a contributing factor, but it wasn't necessarily the cause. The cause has always been there, or been there for a period of time. You need to get that addressed. But low back pain is probably one of the biggest ones there. Secondly, I'd say rotator cuff shoulder issues, because you talked about as far as like the head going forward, the left end of the curve there. Generally, what also happens is so if you look at the front of the body, from your neck down to your pecs and your shoulders, that tends to get rounded forward. We call it protracted. And if someone starts to do bench pressing, say on top of that, or say military press, it'll start lighting up the rotator cuff because their shoulder's in a bad position. So then they lift with that bad position and they start straining their rotator cuff.
So generally, you encourage people like that to balance out the training program perhaps a little bit better, in the sense of doing more pulling movements, maybe even more pulling movements than pushing movements, when someone does have a protracted upper body, more or less. Would that be a good approach?
Right. So when I used to compete in powerlifting, my best bench press was 242.5 kilos or 535. And so that's a lot of force going this direction, but I also had to train the back of my body as well too, because if I didn't, I would start to have that rounded forward. A lot of times you see real heavy bench pressers, they have that kind of like neck going forward, or necks like this, and they have their rounded shoulders. So you want to be able to enjoy life, especially as we get older. And last thing you want to do is have rotator cuff surgery or surgeries like that. So you want to work the upper body, back part, as much as you do the front part.
Awesome. I like it. I sometimes, even if people already come or start with a really dominant, I guess, forward sort of position, I often even like programming a little bit more in the sense of pulling movements rather than pushing movements, so that it's not quite 50-50, but actually more tilted towards the pulling. But of course, as you say, an individual assessment is always best. Now, when it comes to those injuries, I realize that it's not as simple as giving like one straight answer, but do you usually recommend training through injuries or not? Of course, we have a lot of people that are like, oh, I'm going to lose all my gains, or I'm going to gain weight if I stop training completely. And I personally also don't like resting completely because I feel like it makes me even stiffer. And so it's often hard to assess, should I train through this or not? What's your general recommendation there?
Well, when you go back, let's say 50, 60 years ago, someone who had low back pain, the common comment from most doctors was go home, lay in bed, rest it out. Okay. Now they're saying the completely opposite. They're saying no. I like to use the phrase use it or lose it, which means if you use it, you'll keep it. If you lose it, then you're going to have some problems. So in that regard, I recommend you try to train through injuries, but with a big but underlined. Okay. You need to decrease your volume, decrease your sets and reps, and decrease your intensity. So even if it's just to the point where, okay, for example, let's say the track athlete that's coming into my office right now, I told him there may be a chance in a couple of weeks where I may have to say, all right, stop running. I want you to, but you can walk as hard as you want. You can bike, you can go swimming, so you can get some type of movement with the human body. But I want you to stop running because the running is actually exacerbating your injury. So far we haven't had to say that. And I told him it may be a possibility. I had one runner who came in with Achilles tendonitis many years ago, and he wanted me. I was like the third or fourth doctor he had seen for his injury, and so we started treating him for it. And I said, he goes, why are you treating my lower back? Why are you treating my neck? I said, because your whole body is messed up and your Achilles tendonitis is a symptom. And so he goes, okay. So 6 weeks later, he was much better, ran a marathon, set a new personal best in the marathon.
Wow.
Because we took the load off of his Achilles tendonitis, made his legs symmetrical when he ran, and therefore able to do that. So again, I recommend you try to train while you're through an injury, but with the aspect that if it's making it worse, you need to either do something different. Let's say, okay, now I'm going to just go walking. I'm not going to lift weights or anything, but I get some exercise through my body to be able to do it. And it's a temporary thing. I always tell patients we'll be back to the exercise, but once we, building fitness on top of dysfunction is a slippery slope. So when you do fitness on top of function, you can do all you want. So right now, let's get rid of that dysfunction, keep a little bit of fitness going on, just a little bit, and less than you had before. And then when it's turned to function, now we can do all the fitness you want.
That's awesome. I think a really good logical and practical takeaway as well. So for example, with something like the squat, if someone does say, I always have low back pain after heavy squatting or whatever, would you perhaps switch to something like a Bulgarian split squat or a combination of leg press and something else, and maybe just while, of course, addressing why their lower back always hurts during squatting? Would that be an approach to take?
With that, let me ask you a question. With that, would they be seeing someone or just on their own individual person?
Probably just on their own.
What I would do is actually what I would probably back off. And what I would do is we teach it in Strong First, one of the kettlebell movements called goblet squats. And you don't need necessarily a kettlebell. You can take a weight plate and hold it in your hands or whatever else. And I would actually work the goblet squat for a while and get your form and technique down with that, because obviously one thing about the goblet squat, it's lighter weight. Yes. So it won't put as much stress on your body. You're still squatting. There's plenty of videos on YouTube about it. You can look it up and everything with that. But again, I would work on the goblet squat if you're trying to decrease the low back pain, possibly doing, we call it the dead bug. We talked about floor bridge earlier, the hip bridge, exercise you can do as well too, do your stretching. Those are all things that you can do for yourself, and you put in your own personal toolbox that you can just pull out when you need to and utilize that.
Awesome. Yeah. And so I guess talking more about exercises, and as a strength and conditioning coach, do you have certain training principles that you like to apply with your athletes when they come to you for strength and conditioning? Meaning, I want to get as strong and conditioned as possible. I have 3 days per week. What should I do, kind of thing? Do you have certain parameters in there that you might follow?
Well, first thing I do is, so say you came into my gym and you wanted to learn how to lift, you've never lifted before or whatever. I would first run you through that assessment, because I need to know where you're weak and where you're strong. So instead of starting to pile weights on in the squat or the bench or say military press, we got to find where your weaknesses are. Maybe you have a huge weakness on your left side that we need to address. Meanwhile, we give you those corrective exercises. We then start putting you through and teaching you proper technique. In my estimation, and I've done this with my own powerlifting, with my kids, with other people too, you have to work on your technique first. Once your technique is sound, then you can build all the weight you want on top of that. But if your technique's not sound and you build weight on top of that, you're going to get injured. I can literally almost guarantee that. So we need to be proper technique. Then after that, we can start as far as choosing what exercises you would like to do, what exercises that I think you should do. We put them together, and then we start doing that from that point forward. Does that answer your question?
Oh, 100%, yes. And I very much like, again, the emphasis on form having to come first. And I do think and know from personal experience that it's so hard to pull back and work on form first, or even worse, having to correct form is probably worse afterwards than if you just initially took the time. But it's just, if you're a numbers person or you like to see the plates go up and all of that, and then suddenly your coach might be like, no, not yet, let's stay at a low weight and really just focusing on doing the execution slow and steady. It can be really challenging. And again, especially for people that work out on their own, who perhaps don't have that feel either. They might have a mirror in there, or they might watch a video, or even video themselves, which I actually encourage, if you're training alone in your basement, etc., every now and then checking your form. And you might think you're going low enough or you're not low enough. But I think that can be really difficult, because sometimes we think it's only a good workout if we got that burn, or if we got to sweat, or we're sore the next day. Sometimes people think that's a good indication of a workout, and it's truly usually not the case anyway. So I really like that encouragement there. Now when it comes to the nutrition, because you mentioned even with I guess general population, etc., you like to help them I guess emphasize or improve all their performance and movement, etc., through the aid of nutrition. What are your really basic principles when it comes to that?
One of the things I talk to patients about is that I generally recommend that most patients, not all, should be on a high quality multivitamin. Just based on the fact that as far as that our foods are more processed nowadays and more synthetic, they don't have as much nutrition. So you want to kind of hit the basics and just have a good quality multivitamin. I'm not talking Centrum or one a day that you find at the local stores and stuff like that, but high quality multivitamin. You're going to pay more for it, but you're going to get more out of it. With that, after that, based on as far as what their nutritional needs are. So if I look at an X-ray, for example, and I see a lot of degeneration and bone spurs, I may also give them something we call chondroleaf, which is glucosamine and chondroitin sulfate, to help rebuild their cartilage in their body. So as they're getting treated, getting adjusted, doing the exercises and everything else, they're enhancing the structures around it, but we're also going to help build up the cartilage that's in there. And we do that. And I've actually seen changes on X-rays, months down the road, where actually someone's, say, C5, C6 disc space actually looks cleaner. It looks a little bit more space in there. And it has many facets to that, as far as not only better positioning and all that stuff. I like to use something called EPA DHA from fish oil, very specific aspects of that. It helps out tremendously. Glycogenics, which is another made by a company called Metagenics. It's a high quality B vitamin, B complex. I'm not a big fan, and again, not in all cases, of giving someone a specific B vitamin, like say B6 or B1. I mean, I like to give a good high quality complex there, because when you do that, all of them feed off each other. And Agreed. So generally, if you're using a lot of, say, B1, it can actually throw off something else down the road. So again, I like to use that. We use a lot of zinc with people. So I also use quite a few anti-inflammatory, natural anti-inflammatories in my office as well too. There's one I've used since the day I graduated from school called Inflamaze. It's made by a company called, I think, Progressive Labs or Nutrition Dynamics. It is one of the best anti-inflammatory supplements out there.
So it's a combination of various anti-inflammatory
paralytic enzymes that are in there, and it works great. Plus, it also helps as far as digestive issues. So it works fantastic. It helps. Like I tell people, when you take like ibuprofen or Tylenol, those are generally COX-2 inhibitors, which inhibit they block the pain signal to your brain. Whereas this stuff does not block the pain signal. And actually, I call it the kind of the rotor of inflammation, where it kind of gets rid of the inflammation naturally. Now, of course, with getting rid of inflammation, I'm sure you're well aware, being a nutritionist too, that when you get rid of inflammation, it's overall helpful for the human body. But if they're still doing the same things that help cause the inflammation, yes, it may get rid of some inflammation, but it's not going to help them overall. Does that make sense?
Yeah, 100%. Yeah.
So they also need to make some lifestyle changes, change the foods they eat. They need to get more exercise, do all these things to enhance the ability of the supplements to actually do their job.
100%. Yeah, I totally agree. And EPA, DHA, one of my favorites, most certainly as well. You probably also, especially with your athletes, might also use a magnesium or calcium in certain cases as well. But yeah, I like that you take a very much individual approach as well when it comes to supplementation, as for most people, there really is no sort of one size fits all, even though we like to think, oh, I'm just going to pop that multivitamin and it's going to cover all my bases.
Well, one of the things I love is when patients say, yeah, I have these gummies and I just kind of want to put my hand on my forehead and just smack. And I say, do you know these substances they use to make those gummies with besides the vitamins? So one other thing too, I also tell them, I want you to key on the word supplement. So it's a supplementary to your diet. It's not to replace your diet. It's a supplement. So if you're eating at a fast food place, 3 times a day, every day, you can take all the supplements in the world and it's not going to help you.
100%. Yes. Do you also use creatine with some of your patients? Oh, sorry, I think I lost you for a second.
Yeah. So some of my strength patients I use creatine with. Creatine is probably in my estimation, one of the best subs out there as far as for increased strength gains. I use it a lot for powerlifting. It helped me quite a bit. When it first came out, they're saying, well, you can cause some kidney damage, you can cause kidney stones, it can actually decrease as far as it make you lose water. But if you're drinking plenty of water and use it in a smart way, like if you're on creatine 24/7, 365, and you're not doing a heavy training, you probably don't need to use it. Because if you eat meat naturally has creatine in it. So steak has a certain amount, salmon has a certain amount, all this other stuff have certain amounts in there. So again, you're getting creatine naturally. You're just enhancing the ability to utilize it.
Absolutely. Awesome. Well, I really want to honor your time, but thank you so much for all the super informative things you have shared with us today. And I wonder if you might have one or two last takeaways or words of wisdom for just anybody who loves strength training and wants to remain injury-free.
One thing I've been using a lot in the last several years is I tell even the strength athletes to go outside and go for a walk.
Oh,
and I like to use the phrase, go for a brisk walk, because the aerobic aspect with that is something that will enhance as far as your powerlifting training or your strength training, whatever sport you're in, with that. Because I did not do a lot of that when I was powerlifting, and I'm not saying I wish I had, and I don't have any health conditions, but again, it's one of those things that it's important for raising your blood, not your blood pressure, but your pulse rate, your respiration rate, everything else, get a little sweat going. Second thing is don't forget to tell your family you love them and that you need them and everything else with that. Third thing is I just want to say thank you very much for the interview. I appreciate doing this. It was great working with you.
Thank you so much, and I will share your details in the show notes as well. And once again, thank you so much for your time.
Thank you for tuning in. If you enjoyed today's episode, don't forget to subscribe, leave a review, or share the episode on social. Very much appreciated. You can also follow us on Instagram at Nutrition Coaching and Life, or head to our website, www.nutritioncoachingandlife.com, where we provide more valuable content. Have a wonderful day. Now go out and work on your best self.